Welcome to today's webinar, this Dementia Forum, Dementia, the Warning Signs and Why Early Diagnosis Helps. Thank you all for taking the time to be here today, and I think we're all really glad that it's on Zoom because it seems to be it's pretty awful to have ventured out somewhere today. My name's Hema Patel from Sydney North Health Network. I'd like to do an acknowledgement of country. The Northern Beaches Dementia Alliance wishes to acknowledge Australia's Aboriginal peoples, the traditional custodians of the land on which we meet and work. We pay our respects and recognise their continued connection to land, water and community, and honour their ancestors, elders past, present and emerging. The Northern Beaches Dementia Alliance was formed in August 2018. It consists of aged care, dementia and healthcare professionals, as well as community members, people living with dementia and their carers. The partnership includes Northern Beaches Council, Sydney North Health Network, CCNB, which is Community Care and Wellbeing Northern Beaches, RSL Lifecare at Home, and Just Better Care Northern Beaches and Northern Suburbs. The Alliance aims to create a dementia-friendly community on the Northern Beaches to support people living with dementia to have a high quality of life and to be understood, included and accepted. We have just developed a communications card, which we'll send a copy with the evaluation to support businesses, communities in their approach to people living with dementia. We have an advisory group that guides the work that is done. If you if you're interested in offering your services to the Alliance within the advisory group, please contact us via the email address provided. This forum consists, I'll just stop sharing. This forum consists of online webinars weekly for 5 weeks. This is the third in the series, and it's called Dementia, Warning Signs and Why Early Diagnosis Helps. Our speaker today is Dr. Lyndal Newton. Dr. Newton is a Senior Specialist Geriatrician with extensive experience across the breadth of geriatric medicine, including community, Indigenous and hospital aged care medicine. And she's been active in state and federal aged health legislation and service design. Lyndal is the head of department at Geriatric Medicine unit at the Northern Beaches Hospital in Sydney and has private rooms on the Northern Beaches. I'll now hand over to Lyndal. Thank you so much.
Thank you very much for that introduction, Hema, and thank you for inviting me to speak today. It's a great pleasure to do so, and I look forward to sharing with the people who've joined us today a little bit about the dementia journey. So my talk today is really on dementia, where to from here, the early warning signs, and why early diagnosis can help you. So what we'll talk about today is really, what is dementia? How common is it? And what are the early warning signs, so to speak? What do you do? Who do you see? How is it diagnosed? If you are diagnosed with this illness, what strategies and interventions should you do once you've actually had that diagnosis? Are there changes as the disease progresses? Are there support services available? And is there an impact from the delay in diagnosis or a stigma even attached to that diagnosis? There's a lot of things that you might want to talk about today, and this is just what I'm specifically going to address. But I really would like it if you have questions as we go through, that you pop them in the chat, and Hema will advise me of those questions at the end, and we can talk through some of those things that you're finding really pressing in your situation. So what is dementia? I think it's really important to remember that it's not one specific disease. Dementia is really just an umbrella term for a large group of memory impairment problems. There are ways that as medical professionals or other associated professionals in this field, we do describe dementia, and perhaps the NINS criteria, the National Institute of Neurological Disorders, is is really quite useful for you. But I have another description for people who are very scientific and like the nitty-gritty. But for our purposes, dementia is the loss of cognitive functioning, the ability to think or remember or problem solve or even reason, to the extent that it's interfering with your daily life and activities. Many things are normal to reduce with age, but it's when they really start to impact your life that we start to worry that this may be a memory problem. For those of you who know the different types of dementia, there are many types of dementia. There's an Alzheimer's dementia, which is the one that most people are familiar with, commonly called old-timers. There's vascular dementia, mixed dementias, which is, as it self-describes, a bit of everything. There's a new kid on the block called late, which is just a specific type of pathology that contributes to a dementia. There's frontotemporal dementias, so these are dementias that affect a particular part of the brain. And there's other dementias that are associated with Parkinson's disease or similar pathologies to Parkinson's disease. Amongst these dementias, this covers just about all of them, but there are a few other very rare, weird and wonderful ones. And I mentioned for the scientists out there that there is a way that we look at the dementias and diagnose dementias from a perspective of the clinic. And we look at memory disorders, and I've just picked Alzheimer's, but as you remember, there was quite a few other ones there. But when we look at someone and we think they might have an Alzheimer's, we're looking at, is this definitely the case? Is it probably the case? Is it possibly the case? Or is it unlikely? And we work off the basis that as the symptoms and signs become more obvious and we do further investigations, it becomes less unlikely and more definite. And if you look at these slides later, you'll be able to see the difference between the unlikely through to the definite. So how common is the dementias? Well, it's really common. People are unexpectedly surprised when they see what the numbers are. This year, 2021, there's approximately 472,000 Australians living with dementia, and that's expected to increase to almost 1.1 million by 2058. Within that group, if you look at the younger population, so people in their 30s and 40s and 50s, this year, there were just over 28,000 people living with memory problems, and that's expected to go up to 41,000 by 2058. And it may surprise you to know that the majority of people with dementia do live in the community, happily engaged in their daily lives. Often people will present to me saying, if I have dementia, that's the end of me, I'll have to go into a home. And that is specifically and not the case. And that is one of the first things I will tell you. This is a beginning, not an end, because 70% of people live very well in the community with a memory problem. Though if you do look at aged care residents, people who are in homes, and that is a concern for some people, about 2/3 of aged care residents have a moderate to severe cognitive impairment. But again, in 2021, it's estimated that 1.6 million people in Australia are involved in the care of somebody living with dementia. So even if you are not someone who has a memory problem yourself or a memory concern yourself, you may be involved in helping someone who has a memory problem. The dementia prevalence rates amongst Indigenous Australians are about 3 to 5 times as high as the rate for Australians overall. So it's important not to forget our fellow Australians in this group, this population of people with memory problems. And if you think that you don't know anyone who has a memory problem, or you've never heard of someone who has a memory problem, here are some people who have lived famously wonderful and full lives who have had memory problems. Some of them you may not have noticed or even heard had memory problems right up till their later life. There are some risk factors, and I expect many of you will know of these, and you may have heard talks on this before. But there are some things that are protective to help reduce your risk of having a dementia problem. and there are things that are certainly not protective. So the things that we can do something about and modify are things like good education. So in our children, we want to make sure that they stay at school. And it's not really the length of years that you went to school, it's how much you were there every day and how much you participated. It's important to have physical activity and social engagement, be part of society. The more you do that, the more you exercise your brain and the more protective it is against a memory problem. Things that we know are not protective. So, smoking. I think there's so many things about smoking that put the writing on the wall for that, but this is just one more. Smoking is a contributor to cognitive impairment. The other things that are not so helpful to have are hearing loss, depression, diabetes, hypertension, and obesity. The good thing about this is that many of those factors you can ameliorate. You can work on your weight. You can look at medication for your blood pressure and diabetes. You can look at therapies and treatment for depression. And if you have hearing loss, you are able to modify that with the use of hearing aids or other tools that can improve your understanding of the world around you. If you're looking for a source for this information, one of the good places to look is alzheimers.org, and these recommendations come from the World Health Organization. And they are, as we have mentioned just in the last slide, being physically active, stopping smoking, eating a balanced diet, and the Mediterranean diet is often quoted as being very good, and there is good evidence for that. To drink alcohol in moderation. I don't think anyone would say don't drink at all, because we're a social group and we want you to be physically active and social, but moderation is the key. Cognitive training is a good thing, so if you can be involved in any brain activities, and later on in the talk I'm going to give you some internet-based examples of cognitive training, but they are useful to protect the brain. And that social activity is vital. Speaking to people, talking, interacting, asking questions and thinking of answers as people ask you questions is good exercise for your brain. Manage that blood pressure, manage that diabetes, manage that cholesterol, and work with therapists for your depression if you can. And look after your hearing and manage any hearing loss that you have. So there are some early suggestive signs. It's often referred to as warning signs, but warning signs sounds like you're about to plummet into a dangerous situation. So I would say there are signs that are suggestive of things you may want to worry about. And Dementia Australia has got a really good list of these, and the information I've got on the coming slides comes from them because it's very easy for you to access, and I'd like for you to be able to see this information and take it in your own time. So it's important, as any aged care worker or doctor will tell you, not to assume straight away that any memory problem is dementia. There are a lot of things that can mimic dementia, and because of that, it's really important to get these things checked out. By definition, if the symptoms can be better accounted for by something else, we would look for that first before we would diagnose a dementia. However, with that caveat, there are several things that we would look at as clinicians that we would consider to be a little bit suggestive. And so the following things I'm going to tell you are things to consider in a person that you may be concerned about. So some of the early signs. So a recent memory loss that might affect your job skills. So it's okay that occasionally you might forget a meeting or a name or a telephone number. But for most people, when you step away from that situation or your attention isn't distracted, those things will come back to you. You will remember them. But a person with a memory impairment may forget things either more frequently, more often, and subsequently, where a person without memory impairment may remember them later, somebody with a cognitive impairment often doesn't. Sometimes there can be difficulty performing familiar tasks. It is normal that busy people, you're out there living your best life, can be distracted from time to time. So you might be cooking the dinner and you might leave the carrots on the stove and you've served up the lovely dinner, and halfway through the meal you think, oh goodness, I've forgotten to put the carrots out. And you go and you grab those carrots and you put them with your meal and you finish the meal. A person with a memory impairment might prepare a meal. They might forget that they've prepared the meal, and not only forget to serve it, but really forget that they've made the meal. Occasionally, if it's a more risky situation, they might forget that they've left the stove on. One of the common things I see for my patients are people who have been wonderful cooks and really loved cooking up for the family, a great big meal. And with time, they've just decided that it's a bit much. They don't want to cook that much food anymore, and the meals become more simple, or they prefer not to have all the family round together. So sometimes it can be a little bit more subtle like that, rather than just forgetting that you've put meals on the table. Sometimes you can have problems with language. So everybody sometimes has those tip of the tongue problems where they just can't find that right word that they want right that minute. A person with a memory impairment may forget simple words or substitute inappropriate words, such as if you were thinking about perhaps a fork and they say, I want the prongs, because they can't find that word and they know what it is, it's just not coming. And so there's a substitution that's not quite right. So that can happen sometimes too. There can be a disorientation of time and place. So particularly when you're retired, it can be normal to forget the day of the week, particularly if you don't have a routine to your week. If you're not someone who has a task set for every day, it's quite normal to forget the day of the week. I know when I go on holiday, I'm pleased not to know what day of the week it is for a while. And so I want you to remember that that's quite common. But people with dementia can become lost in an environment where they would not normally become lost, such as on their street, or if they're out doing a daily activity, they think, oh goodness, I'm not quite sure where I need to make my first turn. It's unusual in that what they've forgotten is impacting what they would normally do. Judgment is a tricky one because everyone makes bad choices in life. And if you don't think so, you could ask the 21-year-old that went to the pub and had a big drink and had a car accident and thought afterwards, that wasn't the greatest choice that I made. It's normal to make bad choices. However, in memory impairment, if it affects a person's memory and concentration in such a way that they can't think through the risks and the benefits and the options, it may create a problem with their judgment. And so many activities that require good judgment can be affected as well, such as paying bills or driving, and particularly driving where the risk is not only to themselves but to other people on the road as well. This is not to say that you can't drive, and I'm going to come to that specifically later because that is something that people worry about a lot. But it's just to know that there are issues as memory problems can continue. Abstract thinking can become difficult. So as I mentioned with finances, it can be difficult for anybody if you're doing your tax or you're looking at complex mathematical skills, or alternatively having to make a lot of heavy influence decisions where they make a big difference to you. It can be difficult for anyone. But when the person has a memory impairment, with respect to numbers, they may just be looking at the numbers and they don't mean anything, or they're not quite sure what to do with those numbers when they've got them right in front of them. Misplacing things is really common, I feel. I think everyone leaves the house or forgets where they put their wallet or their keys or forgot to lock the door, or there's any one of those minor things that we do in life that are annoyances that we can do. But for a person with memory impairment, they may repeatedly put things in odd places, and that's why they can't find them. An example might be that a person may come into the house with their keys and they think, I'll have a drink of water, and they go to the fridge and they put the keys down in the fridge because they want to grab the water jug. They drink the water, they shut the fridge, and the next time they can't find the keys because they're in the fridge. And so there's that sense of putting things where you wouldn't expect to necessarily find them. Mood and behaviour are really important for you as you get older in this life, maintaining that happiness and participatory nature. And it's normal that people can become sad or moody with time. And I don't think that anyone would say that you have to be a smiling, happy person every day of the week. But someone with memory impairment, those mood swings or sadness that you might get when you watch a sad show or hear of a sad issue in the family, they don't cycle in the same way that we do. So those events, it would be normal to be sad. For someone with a memory impairment, they can have rapid swings from calmness to tears or to anger, and there can be no real sort of stimulation for that sometimes, no real apparent reason for that. You might think, you know, they were just happy 5 minutes ago and now they're terribly sad, and I'm not really sure why. So it's important to remember that it can be natural to be up and down a little bit, but not rapidly swinging and cycling. It's common to have changes in personality. Sorry, it's not common to have changes in personality, I should say. People's personalities, they don't change a lot with age. If you're a type A go-getter person, you tend to be that as you get older. If you've always been a very placid person, you tend to be a placid person as you get older. Sometimes we can change a little bit with retirement. We take a step back and live a slightly more peaceful life, but not fundamentally do we change. But a person with a memory impairment can become quite suspicious or fearful, or even just not communicative and very flat in the way that they interact with others. Occasionally, people can become very disinhibited. So if you're in a social setting with your friend or partner, they may say something that you know would not be something they would normally say. They'd feel that that's not normally socially acceptable, or they're not quite so familiar with people normally, and suddenly they are. So that would be something to be a little bit suggestive that there is a problem. A loss of initiative is common in memory impairment. It's normal to be a bit tired of housework as you get older. It's normal to not be so interested in business activities, particularly if you're enjoying your retirement and you don't want to be involved in that. And sometimes as you get older, you're not so interested in social obligations anymore. You just like to do your thing and not do what everybody else is doing all the time. And that's okay. But the person with dementia or a memory impairment may be very passive. They may sit in a chair all day and time goes by and they haven't noticed, or they might require some cues to prompt them to get more involved in activities. So those are the 10 sort of early warning signs that I would look for in someone that you're concerned about. But there are stages, and these 10 sort of topics that I've given you are really early stage things to look for. They're often overlooked because it can be a very gradual onset. And sometimes the symptoms that you're really seeing are just a little bit of loss of the track of time, a little bit of forgetfulness, and sometimes having to rethink about where you are at the shops. Those sorts of things can be overlooked because they seem fairly minor. There are middle and late stages to memory impairment, but I won't focus on that too much today. It's there for your interest when you read the slides later, but we're really focusing on the early times today. So what do you do? Who do you see? How is it diagnosed? And I think the gold star place to start is always your local doctor, your GP. Someone who you either have known for a long time, or if you don't have a local doctor, someone that you might need to form a future relationship with. When you go to your GP, what might they do? Well, they might do some screening tests. They might offer you even a preliminary diagnosis. Or if it's a little bit early in the process, they may refer you to a specialist who can help. And again, I remind you, it may not be dementia. So it's really important to not be too concerned, but to think, what might this be? There's a lot of things that mimic dementia. strokes, depression, alcoholism, infections, hormone disorders, nutritional deficiencies, and at worst, things like brain tumours. But all of those things, or I should say most of those things, can be remediated in some way, and you may find that the memory can be improved in those circumstances. So it's really important to get a correct diagnosis. And if you consult at an early stage, then we can provide therapies and treatments that can improve that memory loss so that you're not concerned going forward. I've included this for you. This is something that was done from Central Eastern Sydney Primary Health Network some years ago that I was involved in, and it's a nice little pictorial that shows you that a memory impairment diagnosis is really just a pathway, and it's a way to go through the memory issues and inform you of how and where you might need to seek help as you go along. So if you'd like to, a bit later on when you've got some time, have a look through this, and it may give you some information about how to work your way through the path of dementia. When you see your GP or the specialist, what they will normally do for you is quite a detailed history and an exam. Importantly, if you can take somebody along with you as a corroborative storyteller, it's really useful to do that. I think it's important because they can support your story. They can tell the medical professional, the doctor or other allied health persons you're speaking to, information that you may have forgotten. At the time, they can support you as well if perhaps the story you're telling is not something they have experienced as your associated friend or partner. At the time, you will get a thorough physical and neurological examination. And in that sense of examination, you will have a set of tests on your senses and movements. They will identify any illnesses which may cause confusion. They might even perform some blood and urine tests, and I would expect that they would because that's often normal to do. We commonly do some imaging, some CAT scans or MRI scans. We then would look at doing some neuropsychological testing. It sounds like a big word, but what that really means is we look at your comprehension, your insight, and your judgment. We do a quick mental status check, which looks at your intellectual functions, such as memory, your ability to write and to read, and to calculate. Occasionally, we will do a psychiatric assessment ourselves or send you to see someone who may have some expertise in this area. But primarily what we're looking at is identifying depression, because this is very treatable. We also want to manage psychiatric symptoms such as anxiety or delusions, which can occur alongside a memory problem. So what do you do once a memory problem has been diagnosed? You come, you see the specialist, we do some tests over a few days to weeks, and you come back and see us and we say, I think you may have a memory problem. What do you do? Well, I think if someone's telling you that you've got a memory problem, you need to think about what you enjoy in life, because you don't want to be doing things that take away your enjoyment, your ability to focus and to find concentration. And it's hard to concentrate on things that you don't enjoy, and it's hard to protect your memory if you're doing things that you don't enjoy. So focus on the important things. What do you like in life? What things are unhelpful to you? Create opportunities for yourself to do things that you find enjoyable. Spend time with your family and friends. Participate in conversations. If you are a person with some spirituality, it may be the time that you feel like you want to revisit that, to share with others how you feel about this development in your life. Keep your brain and your physical activity in your daily life. Be active with both brain and body. Sometimes you may find it helps to have what we call aides de memoires, so things that help you remember. So the prime example would be things like diaries, date books, notebooks, post-it notes, alarm clocks to make sure you're getting places on time. One person I know has put a sheet of clear contact on their fridge, and they use a whiteboard marker to write on their fridge and rub it off every day, the things that they want to do that day. It's important to have your sensory aids, so your hearing aids, because if you hear and you register information, it's much easier to recall that information later than if you didn't register it in the first place. Make sure your glasses are appropriate. In dementias, often it's not all just about memory. It can be things like your perception of what's going on around you. And if you have bifocal glasses that alter your perception when you're walking or reading or seeing things, it can cause accidents or injuries. So it's important to have glasses that are appropriate for you. It's important to remove irritants in the house, whether they are smells or colours or mats, anything that's really annoys you about your home. Because when you're irritated, it's harder to retain or register information and recall it later. It's important to put things in a really obvious place. It seems an obvious thing to do, but if you've got lots of bits and pieces, flotsam and jetsam around your house and on your table, it's very difficult to find things. If your table is very clear and the only thing sitting on that table is the one thing you want to do that day, then it's much easier to remember to do that job. If you are somebody who doesn't like maths or that's becoming something of a problem with your memory, you might want to set up some direct debits, which will make paying for things much easier later on. One very clever thing that a patient of mine does is keeps a spare set of keys and money in her handbag. She would often leave these things at home and she would get stuck. So she would have the keys on the table ready to go. She'd lock the door, she'd leave the house, and the keys were left on the table. So now she has a second set of keys in her bag that she leaves in the bag, so that if she locks herself out, she can get in and there's always another set of keys on the table. Do one thing at a time. If you have people in the home with you and you know that you get distracted when you're doing one task, it's really useful to say to people, I'm going to do a task now. Could you please not interrupt me till I've finished? Because if you do, I may not be able to complete that task. And for people who are around you, many people will be very supportive of managing that way. There is some truth in making your decisions easier. Just as you can unclutter your house, you can unclutter your life. And sometimes it can be difficult to get dressed in the morning if you've got a closet full of clothes and it's overwhelming to look. So if you find that there are a lot of clothes that you don't use anymore, just having those few items that you wear every day right there in the cupboard and the rest of it packed away for another time can make decisions in the morning very much easier and makes the anxiety around the start of the day a lot less. It's really important to keep your home life happy and active. Things that we do quite normally, such as cleaning, gardening, cooking and dressing and grooming, they're all learned skills. And so it's important that we keep active in those skills so that we don't unlearn them, so that they don't pass by the wayside. They can be challenging with memory problems, and so it's important if you enjoy those activities to continue with them. If you don't enjoy those activities, it's important to plan ahead for a time when you don't want to do them. When frailty or aging and frailty and dementia are present, those issues can just be that much harder to remember, and so planning ahead is good. Carers and people with memory and problems are often worried about their own safety at home or the relative safety at home, such as falling and leaving cooktops on, etc. But there are things you can do to help reduce those risks or concerns about safety. And one of the things I would recommend if you do have some early memory problems is to speak to an occupational therapist, and you can access those through ACAT or privately, that can look at your home and have a look around it and say, look, these are the things I would change to keep you really independent in your home. I'll just stop for a moment. while that announcement goes. So it aims to keep you independent and doing things for yourself, rather than focusing on doing things for you. But if you do need some help doing things, the services can attend to those needs and help you to remain at home for longer, especially for those who are a little bit frailer. I mentioned earlier about brain training. So if you're someone who has an early memory problem and you really want to work on that memory, or you're just know someone who has a memory problem, or you're just really keen to improve your own brain function, here are a couple of websites where you can do activities to stretch your brain and keep your brain healthy. Social stimulation is really important as well. And there are cognitive stimulation therapy groups available online, but they are usually pay groups and a little bit pricey. And it would be just as equally beneficial to participate in a good group chat where you have to participate and respond and be a member of that conversation. I mentioned we would come back to driving and talk about that a little bit. It's really important to know that you don't automatically lose your license if you have a diagnosis of dementia. You are, to a certain extent, obliged to let the RMS know, the Roads and Maritime Service know, of any condition that could affect your driving, and so is your doctor. But the Roads and Maritime Services testing will ask your doctor to provide an assessment of your ability to drive. And if your doctor is happy at the moment that you're safe to drive, then you can continue to drive. If your doctor is unsure, then they might refer you to an occupational therapy driving test. These fitness to drive tests are conducted as you would expect by occupational therapists, and they have both an on-road and off-road component. The off-road component, they look at things like your memory and your reaction times and your vision, and then that's followed by a practical exam where they get you in the car and they see how you go. There is a certain point where if your off-road component is too poor, that you won't be able to do the on-road component, but in early memory issues, that's very uncommon that you won't get to participate in the on-road test. The only problem really with these tests is that they are conducted by private occupational therapists and they can be expensive. But always remember, if that driving is no longer an option for you, there are other options that can be sourced. There are many ways to get around that don't involve the expense of owning a car. It's really important to get out and about, and I've sort of referred to all of these things throughout this conversation we're having, but it's really important to choose memory-friendly activities. Try not to pick activities where you're going to become frustrated or annoyed. Attend groups for people with memory impairment so that you can share experiences and have experiences shared with you by other people in your situation who have examples of what they did to get around the problems they were having. It's a group that can help you. Keep your details on a piece of paper in your wallet or handbag. If you find that perhaps in the afternoon you're not quite as good as you were in the morning and you have trouble with your words or memory, it's useful to have a prompt in your handbag or your wallet. Some people like an item of jewellery, such as a medic alert bracelet, or a lot of ladies that I know have very glamorous jewellery that on the back of that jewellery says the important information that they feel should be there, whether it's a name, an address, a phone number, or just that there is a memory impairment. Whatever you put on that bracelet can be helpful if you're in a spot of bother. If you are somebody who uses a smartphone, it can be useful to take photos of where you left the car. If you find that you're constantly forgetting where you left it, take a photo and then you'll be able to find the car. You can put tracking on your phone. If you're worried or you're worried about your family member as their memory is becoming poor, that you might lose them, you can put a tracking application on the phone so you know where the person is. Always remember that anyone can lose their place in a conversation, especially if you've got excitable, chatty friends, and it's okay to lose your place every now and then and say, I'm sorry, I missed that, or I didn't hear you, and reintegrate yourself in the conversation. That's okay. If you're ever really worried, and if you're worried to the point where you won't go out and socialise because you're concerned that you'll be stuck in a conversation, it can sometimes help to take a friend. And that friend, you can say to them, if I look like I'm a bit upset or worried, can you help me out with a bit of conversation? That may help you to be able to go and participate in those social activities. But you know, if it's all too much, if you're sitting there and it's too much stimulation and you're not interested, there's no harm in saying, I'm going to take a break, I'm going to get up, I'm going to go to the bathroom, stretch my legs, and come back and have some time for you. Keeping that healthy living and supported well-being is vital. As we've said, healthy diet, healthy exercise, making sure your general health is good, finding joy in your day, limit the bad, keep the good, find some social groups, be active, and most importantly, get good sleep. As we get older, our melatonin, a chemical compound that tells us when to go to bed and when to get up, gets less. It naturally drops once we're over the age of 70 in a slow decline. And it's often why as we get older, we sleep less. So it's important that if you're really having trouble sleeping, that you look at good sleep practices, not too much light before bed, not watching horrible, scary films or things that are going to get you going right before you go to bed, making sure that you're not filling your bladder right up before bedtime, keeping your day activity up so that you do get tired when bedtime comes, and having that melatonin possibly supplemented if you need to help you have a normal day and night cycle is really important. Without sleep, we can't pay attention, and without attention, we can't register information, recall information, and remember it when we really, really need it. In the first point there, I've mentioned dementia supplements. There are some supplements on the market that have some evidence to help reduce memory loss in very early dementia. I'm not going to mention any brands today, but if you're out there with the pharmacist, you may want to ask the pharmacy at your local chemist what sort of things that they have that might help with early memory loss. There are some support services available, and I've got another list of resources a bit later on, but these are the ones in your local area that are very useful to you, and these will be on the slides for you to look at later. If you're not sure, you can always speak to your local ACAT, your aged care assessment team, or access My Aged Care. And through those sites, you will be able to access the information that you need to find the support programs that you need, even if they are not the support programs themselves. They will tell you how to access them. Some additional supports for the Northern Beaches, and some of these are involved in this talk today, but it's important that you have access to these support services as well. So why should we promote early diagnosis of dementia? Well, a thorough and prompt assessment by medical professionals is a right that everybody has, and Dementia Australia lists these on their website so that you can look at these as well. It's important to have some sensitive communication of a diagnosis with appropriate explanations of symptoms and prognosis. Everybody has a right to sufficient information to make choices about their future and to have maximal involvement in those choices and decision making. It's important to have ongoing maintenance and management and access to support services. There are barriers, though, to getting people to come for early diagnosis of dementia. And sometimes it can be as simple as the belief that the memory problems are just a normal part of aging, thinking that it's quite normal to forget things and I don't have a dementia and I shouldn't be worried. Sometimes it's the perceived stigma around dementia. A lot of people still worry about what it means in society to have a problem with memory. For others, it's a real and genuine concern that if they receive this diagnosis, it puts them in the line of an illness for which there is currently not a cure. And that creates a lot of fear about the future. And so people don't want to be exposed to that fear, so they'd rather not know. But a delay in diagnosis can, for those people in particular who don't want to know or don't want the fear, if they have insight or are worried about the diagnosis, they don't receive reassurance. And as I stated earlier, it may not be dementia, and we may be able to reverse the problem. So delaying the diagnosis just creates further worry and distress. It can limit your ability to plan ahead in a time when you have good function to do so. It can limit your control over your future for the very same reason. This is the time when you have the most ability to make decisions and have control over your future, and you aren't getting there. It takes time away for the important things. You continue to worry about things that are not so important to you and don't focus on what really is. If you're interested in participating in trials for memory loss, if you don't get diagnosed early, it limits your ability to participate in trials for memory. And you're not able to really talk to anybody about medications and whether it's appropriate to start them or not if you don't have a diagnosis. When we look at stigma, we do find some people have associated shame with this diagnosis that they don't have with other chronic diseases, which is a really interesting thing. If you are told that you have chronic diabetes, people tend to be not so worried about that as they are about having a memory problem. And usually, as with all stigmas, they're based on a misunderstanding of what it is to have this chronic illness as opposed to an acute decline. Mental health advocates have had to deal with this for many years, and this is what the green ribbon is. It's mental health advocacy for stigma of diagnosis. And popular media can share some of this blame historically in the way that they've portrayed people with memory loss and dementia or mental health in films and television and books. But nowadays, it's a very useful medium to get our message out there about the fact this is not something to be ashamed of. There are lots of myths associated with dementia, and there's a group called Forward with Dementia, and some of these myths come from their website, and the link for that is also at the end of my talk. One of the myths is that people with dementia are victims suffering from a disease. But the fact is, many people with dementia are very much in control of their illness. They're very comfortable, content, and even happy that they've had this diagnosis, and they can get on with life and do the things that they want to do. The second myth that's quite common is that once you've had dementia, you can't learn anything else. That's it. It's all done. And that is very much not true. People with dementia continue to learn just as we all do. The third myth is that there's nothing that can be done for dementia, and that is very much untrue as well. There are many treatments and strategies that can slow the progression and help with symptoms in dementia, and another reason, therefore, why it's important to get in touch early. But resistance exists. There are people who don't want to know. They either have no insight into the problem, so you as the family member or friend can see something's not right, but the person themselves doesn't have insight. Alternatively, the person has insight but doesn't want to know. So how do you deal with resistance? If you are a carer or friend of someone who has memory problems, it's often useful to try and find a medical reason or a physical reason to visit the doctor. You can, if the person is willing to accept this, you can say that I've noticed the memory is not so good at the moment. That can sometimes be related to blood pressure or being tired or bad eyes. Why don't we go and talk to the GP and see if your blood pressure is up or your diabetes is mucking up or one of those illnesses that they find acceptable or tolerable to visit a GP for. And when you're there, you can mention the memory issues and that perhaps there's an association, and it gives the GP an indication of what you're worried about. Suggesting an examination of the heart and medication reviews are also ways you can get people there. Occasionally, it's not just a problem for the person who has the memory loss, but the partner may not accept that there's an issue for either of them themselves. And so as a child or friend, you may say it's a really good idea when you get over the age of 70 to have an elder annual health check. And you put this in the context of being a really normal thing to do, to go and have an annual checkup. And during the checkup, you can mention or suggest that they mention having a memory check as well. Denial is not just about not believing you have a problem, but it can actually be a cover for someone who genuinely is very worried that they do have a memory problem. And so sometimes it can help to uncover those fears and ask, what are you worried about when we go to the GP and ask about memory? Is there something you're really concerned that they're going to tell you? And try and work through some of those fears very kindly and gently. And that may allow the person to accept a trip to the doctor to just check, to just have a look. And if the person won't visit the doctor, or there is no insight from any member of the family and you are really worried, you can talk to other people who've been in these situations. And through the Dementia Alliance and ACAT and others that we've mentioned already today, there are many people who've had to deal with similar situations, and it can pay to talk to those people. Your aged care assessment team is very used to these questions, and if you're really concerned, you can have a chat to them. And if you really don't know who to talk, or you're not sure about how to get onto your local ACAT team, the National Dementia Helpline has a 1-800 number and will be able to point you in the right direction. That's fundamentally the end of my talk, and I'm really happy to take some questions now and look at the chat. I'm going to leave up on the screen just some of those resources I used today that you might want to either bookmark now or wait for the presentation to come up on your internet. But I'll leave it there for you to look at, and I'll head back to Hema and say if there's any questions.
Thanks, Lyndal. That was fabulous. And you've really explained the journey in very clear and simple way. So that's wonderful. We've got some great questions here. The first one's about hearing loss. How does it impact? Is the deafness issue a direct cause, or is it because it causes isolation?
There's quite a bit to that question, actually. Hearing loss, there's lots of reasons why. So the primary one is that you're not hearing the information and registering it, and therefore you can't recall it later. So it's not so much a direct cause of dementia as it can worsen the symptoms that you have because you're not accessing the information in the first place. That's one reason. There is some evidence that people with hearing impairment have worse memory performance, and there's not a lot of evidence on why that is, and that there's not a clear neurological pathway as to why that is, except that those areas of the brain which are responsible for hearing don't develop as well, and therefore the pathways through the brain can be a bit slower. But they are pathways or neurophysiological studies that are still under investigation, so it's not definitive that it's that. But it's also, as the person mentioned, part of the social isolation as well. So you're not getting out and you're not mixing, and it creates that isolation, which is not protective against memory loss.
Great, thank you. Another question was about working past retirement, sort of as you get older. Is that actually protective and beneficial even?
Yeah, there is evidence that working longer keeps you more brain active, but I would put a caveat around that to say that high levels of stress are not good. And so if your employment is something that is not stressful and allows you to interact with people and do calculations, planning, process work that isn't stressful, then yes, it can be protective to work a little bit longer.
Okay, that's great. With the medications, are there any promising medications in the pipeline besides Aricept? And also I've got another question about a natural product in the USA called Preceptor. There's a couple of questions there.
Some of that I can answer, and other bits I won't be able to, because I'm not familiar with Preceptor per se in any great detail. But there's different types of medication for dementia, and I didn't talk about that in the body of the talk, so I'll keep it fairly brief but answer the question as directly as I can. There are two types of medications that we look at for dementia. There are the commonly known ones, such as Aricept, which are not curative treatments. They're medications that we use to try and help slow down the progress of dementia. And we sometimes use them for later in dementia, for behaviour management in dementia. But they are not preventative treatments. They are medications that help to slow down the progress of dementia. The other group of medications that have been worked on by multiple drug companies over recent years are medications aimed as a cure for dementia. And they work on a particular type of pathology in the brain. And up until recently, there's been no successful trials in these medications to treat dementia. So they're often immune therapies that are being used. And the one that has some evidence for it now is called aducanumab. And this is an immune therapy, and it's been going through the licensing process in the States, and also United States, I should say, and also in Australia. And there's some evidence that if you get somebody who is diagnosed with a pure Alzheimer's dementia, so not any of the other sorts of dementia, a pure Alzheimer's dementia, and you can prove on a radiological imaging, so an MRI scan or a functional scan, that's called a PET scan, if you can prove that it's an Alzheimer's dementia, this drug has had some promising reports that it helps in the early part of dementia. But the research is new, and it's going through public trials now, and we will see with time whether this is in fact a useful drug or not. When it comes to natural compounds and the ones that were suggested, there are all sorts of research, or there is all sorts of research that has gone on into all of these natural therapies. And when you do them in small research trials, they are often very positive. But when you do them in large randomized controlled trials, the evidence is much less convincing. So what we often say to people is, if they do not interfere with the drugs you're taking and they're not causing any harm with any of your other medical illnesses, then there is no reason not to take supplementary and supportive medications if there is no harm. But if they are interfering or they are a choice on its own, then we don't recommend them as the sole therapies. Does that help? I hope that helps.
Yes, that's great. That does give us a really good idea of how the medications stand. And I think somebody had mentioned that they've taken omega-3, and it's been wonderful for their brain health as well. I've got a question about diagnosis, where it may not be dementia, but maybe other things such as hormonal issues. And if that's the case, what sort of specialist would you see for that?
If you are unsure, then it would be reasonable to attend a general physician or a geriatrician whilst we're working through what it could be. Once you've actually been diagnosed with a hormonal problem, then the most appropriate people to see for hormone problems are usually endocrinologists, or if it's a problem with sort of postmenopausal, if you're earlier in your menopausal life, sometimes that can be gynecologists and obstetricians who deal with specific menopausal symptoms that can be useful. So it depends on which hormone is the problem. If it's a thyroid disorder, it would be an endocrinologist. If it's a female hormone problem, then the obstetrics and gynecology doctors would be the way to go.
Great. Just one last question, because I think we're pretty much out of time. And I've got a couple of questions really around isolation. So there is a question around, I'll just read a couple of them. What impact do you think the COVID-related lockdowns and isolations will have on rates of dementia in the future? And the other question, slightly different, was someone commenting that mum felt quite shunned or judged with friends when in the early stages of memory loss. What can you say to friends to help garner support instead of judgment? And I think that's come through, that you sort of this whole idea about social connection and social activity. But I think there's a lack of confidence sometimes, or sometimes I've heard that, you know, people are chatting more to the carers than to the person with dementia, that sort of thing. So the isolation, I think we're talking about, that comes through this.
With respect to the COVID question, I think we will see a rise in presentations of memory problems, and it's not necessarily all going to be dementia. I think there's a lot of stress and depression that has been created through isolation, and those people who are coming with those symptoms associated with stress and depression will be able to work through that with good therapy and improvement, and that will be better. I think for those people who have some cognitive loss and weren't aware of it, the COVID may have brought some of that out. The social isolation may have brought some of that out, because they haven't been practicing in their social lives that connection, and so it may become more obvious. And I think those people will start presenting to their GP complaining of memory loss. So I think they're people we would have perhaps seen later, but we're going to see them a bit earlier now, I think. As for the overall effect, I don't know that anyone will really know the exact numbers and data. I just think that we are going to see the effect of that coming in the next 5 to 10 years. With respect to the question about what you say to your friends and things, sometimes it can be that they also need to be educated, just as the person who gets the diagnosis needs to be educated about what it is to have a memory problem. If you remember in that slide on stigma, I was talking about it's often a result of misunderstanding or misinformation. And sometimes if you have a tea with your friends or a social meeting with your friends, before you actually tell them that you may have the diagnosis, you can talk about memory loss and what dementia is and those sorts of things before you say that you are having a problem with that. The alternative is that if you do have a sort of upfront personality and you're right out there and you want to tell your friends, you tell them up front and you say that the expectation is that early on I'm going to be just the same and not have many problems, and if I do forget things, just give me a little elbow and a reminder and I'll be right. And say, as I get more forgetful, I'd like you to help support me if you see I'm doing something strange. And then they become partners in your pathway. Rather than people standing back and watching you, they become involved and helpful. And that would be the thing that I would recommend best for those.
That's fantastic. Lyndal, thank you so much for your presentation. And we've got some amazing comments on the chats. I think that everyone's found it a really, you've made it very simple to understand. And I'm hoping that in terms of friends who don't understand and families, maybe even this presentation, if they could take some time to look through this, I think it would give them a better understanding of the person that they care about. So yes, thank you.